What is atrial fibrillation or AFib? Atrial fibrillation or AFib is atrial fibrillation. Atrial is when you don't have a regular heartbeat. Sometimes your heart beat too fast. Sometimes too slow. That means you may have your heart or in your lung. If you are diagnosed, then you might be taking a medication indefinitely for the rest of your life. That's very rare. People have they don't start the blood thinner medication yet because they don't have any factors such as over 75 years old or high blood pressure. Generally, if you have atrial fibrillation and do not have any additional risk factor, then you don't have to medication yet. They may put you on. So when you have a fib, you don't to select one the oral retinal medication. If it is not regular, you may start with the Aliquis or Badaxa opinion. You don't have monitoring tests like warfarin. If it is regular, then you have to take hope. This depend on what AFib, and your doctor might put you on the best. If you have any further question on this, please give me a comment box below. Thank you. protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If cause the protein C S deficiency, then you need to take a blood thinner medication for 6 to 12 months. When you have a blood clot in your leg, like deep vein thrombosis, if you don't know the cause, then you may need a blood thinner medication. So the best medication for this indication is warfarin. Other medication like Eliquis or abcedin, Xarelto, Rivaroxaban, that's the big brand. Antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If antithrombin deficient, you don't know the need to take the blood thinner medication for 6 to 12. If you know the cause of the blood clot, and you might need to take medication for 6 to 12 months. If you don't know the cause of the blood clot, you need to take blood thinner medication for life, especially a blood clot, your leg, or your medication for this indication is warfarin. you have any further question, you know, in the comment box below. Thank you. Factor 5 latent deficiency treatment duration. What is factor 5 latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor latent deficiency. First one is homozygous factor 5 latent deficiency. This high single risk of having blood clot. If you don't have any blood clot in your leg, then you may not need thinner medication. If you do have a blood or your lung history, take a blood thinner medication such for 6 months. The second type of factor deficiency is zygous. This is the major or multiple risk of if you are diagnosed type of factor 5 latent deficiency, then you may a blood thinner medication indefinitely, regardless of blood clot in the past. The best medication for this indication is warfarin. There are ongoing studies for the other medications such as Alaquip and Daxa for this. If you have any further question, please let me know in the comment box below. Antiphospholipid antibody syndrome, AAS, or lupus anti-treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot, so they may have blood clot. If you have antiphospholipid antibody syndrome, anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. Medication for this is warfarin. You should avoid taking Alaquist, Gerotol. If you have any further question in the comment box, thank you. If you have rheumatic microbial, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take blood thinner medication for the rest of your life or indefinitely. The best medication for this condition is warfarin. If you have a history of rheumatic disease and you have acute blood pulmonary embolism, like clot, then you may need to take a blood thinner medication for the rest of your life. Definitely. And the best medication for it, if you have any further question, please let me know in the comment box below. Thank you. pulmonary embolism, or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a in your lung or the cause of the blood clot, you may only need to take a thinner medication for about 3. If that is, you have a blood clot in your lung. If you don't know the cause, why you have a blood clot in your lung, and if that is the first time you have a blood, you have to take a blood thinner medication to 12 months. Have a second time blood clot in your lung, and blood clot in your lung, you need to take a blood thinner medication definitely, or for the rest of your life. If clot in your leg and blood clot in your lung, so that constitutes the recurrent blood clot. You need to take a blood thinner medication indefinitely or for the rest of your life. If the blood clot is considered rich for the then you may need to take a blood thinner medication longer, maybe for the rest of your life. And you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication so you no longer have cancer, and at least for 3 to 6 months. A blood thinner medication at least 6 months and until you have active cancer. If you have any further question, please let me know in the comment box below. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? To take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know the cause of blood clot in your leg, then you need to take cyst if that is the first time you have a blood clot. If you have a second time or recurrent blood in your leg, then you may need to take a blood thinner medication indefinitely for the rest of your life. If the cause of blood clot in your leg is an active cancer, you need to take a blood thinner medication. You no longer have a cancer. This is general information for how a blood thinner medication if you have a head or a deep vein. If you have any further question, please let me know in the comment box below. Thank you. Micro heart valve treatment. If you have micro heart valve, a blood thinner medication for the rest of your life. The best medication for your mechanical microheart valve is warfarin. If you have a bioprosthetic microheart valve, you might only the medication for about 3 months to, to be aspirin for the rest of it. This is a general for how long you have to be on blood thinner medication if mitral valve. You should follow, including treatment therapy. And if you have any further, please let me know in the comment box. So, thank you. Transient ischemic attack, TIA, or mini stroke. So the duration, the clinical adjustment, so it depends. After the you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some, they would have to an anticoagulant such as warfarin to make sure the transient attack, TIA, is stroke. If you have any further question, please let me know in the comment box. Thank you. aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a blood thinner medication clinically for the rest of your life. This medication is warfarin. If you have bioprosthetic aortic heart valve or TC valve, then you might need to take medication for about 3 months. You take aspirin for the rest of your life. This is general information for how long you have to take the medication. You have aortic, your cardiologist will tell you exactly how long medication, aspirin. If you have any further questions, know the comment box below. Stroke and blood thinner medication treatment duration. So if you have a stroke and you have to take a blood thinner medication, you know how long you have to be on a blood thinner medication. Your stroke is of embolic that atrial fibrillation, then you have to take a blood thinner medication for the rest of your life. The best medication for it is warfarin. If it's not embolic, then you don't have to take a blood thinner medication, but you may need the aspirin or beta-grow or plavix definitely or for the rest of or cardiologists will decide what is the best treatment and duration. You should follow their instruction. If you have any further question in the comment box below. Thank you. Related cardiomyopathy treatment duration. If you have related cardiomyopathy, you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of your life or indefinitely. If you have dilated cardio and left ventricular or LV, take a blood thinner medication at least 3 months. The best medication blood thinner is warfarin. So if you have a history of dilated cardiomyopathy and have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a blood thinner medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy, have a left ventricular thrombus, then you may need to take a blood for at least 3 months. The medication is you should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further questions, please let me know in the comment box below. Thank you. Bye. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methadone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin, name for the oxycodone, is extended so it can out. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease is arthritis. Arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication. Tylenol, Motrin, the research shown before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. It can be the doctors quickly prescribe. Manufacturers responsible for drug abuse, if they fail to manage their distribution of the opioid abuse, might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. The opioid effect or the OxyContin effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of logical issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to ease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You use non-opioid pain relief, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means You want to have the same feeling the opioid give you. The opioid effect, they give you a good feeling like high, so you continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs, such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including OxyContin or oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin lawsuits to pharma. A lot of people will die because of the common long extended relief effects. The manufacturers had to, and now supply has problems. The drug cartels take some advantage about that. They use the illegal drug. The people see content abuse, addiction, looking for drugs. They are starting heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. Have money drug that will commit. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioid, prescription opioids. Illegal opioids, heroin or coke opioid, illegal drugs such as marijuana, methaqualone. Marijuana might be legal in some states, and the prescription opioids, including OxyContin or oxycodone, fentanyl. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids, including OxyContin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major surgery. You should use non-opioid medication. Tylenol, Motrin, peer research shown before an opioid or a low-dose opioid as possible to avoid major addiction, high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it get into the United States via the Mexico border. People who have the heroin oxycontin addiction or dependence, they start using the fentanyl. Maybe more convenient and it may be cheaper or stronger effects. The oxycontin supply had some issue that there are ongoing lawsuits to its effect. The producer to fry